Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Pacemaker potential. The pacemaker potential is aka known as the pre-potential. It is known as the pre-potential since it brings, so it is nothing but the pre-potential, and this is since to the threshold level. So it is the pre-potential since it brings the membrane potential to the threshold level, and which then triggers the action potential. So it triggers the action potential. So there is something known as a phase 4. So phase 4 is nothing but the opening of the HCN, that it brings the sodium in entry. So phase 4, the opening of the HCN, that is the sodium entry channel, this becomes slow. Next comes the opening of the T-type calcium. So T-type calcium. So T-type calcium is nothing but it is again slow. Then comes the decreased permeability. Decreased permeability of the K plus. Then we move on to the phase 0. Phase 0 is nothing but depolarization. So phase 4, then phase 0 is depolarization. There is opening. There is opening of L-type calcium channel, and this is again slow. So far everything was slow. So phase 4, then phase 0 depolarization, opening of the L-type of the calcium channel. In phase 4, it was opening of the T-type of the calcium channel, which is again slow. Then moving on to the phase 3. Phase 3 is nothing but repolarization, and there is opening of delayed rectifier channel. Opening of the delayed rectifier channel, and this is again slow, and then there comes the closure. The closure is of the L-type. Closure is of the L-type of the calcium channel. So let's look at its ionic basis. So in terms of its ionic basis, in early part there is an opening of the funny channels. The opening of funny channels, that is nothing but the HCN. So there's HCN channels. This includes the hyperpolarization activated cyclic nucleotide, gated channels, so which produce an inward funny current. So they produce inward funny current, and these currents are activated by the hyperpolarization, and they can pass both. So it passes both the sodium and also the potassium. Next is the decrease of the outward current, and this is nothing but the potassium decay. Thus there is a decrease in potassium efflux, and makes an indirect contribution to the pacemaker potential. Then in the later part there is an inward calcium current, and this is due to the opening of the T-type calcium channels. So the calcium, it sparks, that is, it releases a calcium locally, from the sarcoplasmic reticulum, and also it contributes to the pacemaker potential.